How has Brexit impacted the NHS? Are there any alternatives to striking? And is the NHS letting down our rural population? Hi, I'm Manpreet. I'm a medical student at the University of Birmingham and a presenter here at the Aspiring Medics. Today we're going to go through 10 key questions surrounding the NHS. And if you haven't done so already, please do like, subscribe and comment down below.
Station 1. How can healthcare workers address their concerns effectively without striking?
So striking essentially refers to a work stoppage, and this is seen or has been seen a lot in healthcare, where a lot of healthcare professionals like doctors, nurses, physiotherapists are all striking for things like better pay, striking against poor working conditions, long working hours, and particularly in healthcare, this can raise a few issues surrounding the delivery of healthcare to patients, which can often be delayed, leading to worse healthcare outcomes for patients. However, that being said, there are a lot of ways that we can, or healthcare professionals can, advocate for their rights without striking. And these involve things such as lobbying government policymakers, forming collaborative committees, engaging in an open dialogue. In terms of engaging in an open dialogue, healthcare professionals can have consistent and frequent discussions with their management to really identify problems and solutions. And they can do this by offering evidence-based proposals where they're using this to find exactly what the problem is and coming up with effective solutions in order to tackle them. And they can do this by forming collaborative committees as well, where different types of healthcare workers all come together and address the same or similar issues as one as well. Additionally, healthcare workers can also increase public awareness via campaigns which are online or in person to really help the public understand why this is an issue for them too. And finally, healthcare workers can also directly lobby policymakers in the government to address these challenges or to address these issues which are often systemic. So overall, strikes can be very disruptive, but there are a lot of ways that healthcare workers can address their concerns in other ways.
Station 2. Explore the impact of Brexit on the NHS workforce, including the recruitment of healthcare professionals and its effects on patient care.
So Brexit was finalised in 2020 and it was the UK's official withdrawal from the European Union. And it has meant that we have seen a reduced workforce from the EU. We have seen increased challenges in terms of recruitment. We've seen a rise in vacancies, as well as a negative impact on patient care. In terms of a reduced workforce from the EU, less professionals, healthcare professionals from the EU are applying to work in the NHS, which now means that we have a smaller pool of talent to pick from and to work in the NHS. Additionally, it has also meant that the increased immigration or the stricter immigration rules has made the recruitment process a lot more tedious and a lot more tiring. Additionally, since less people are applying to work in the NHS, particularly from the EU, or we're hiring less staff, it has meant that we have a rise in the number of vacancies that we have, which has a negative impact on rotas and therefore the quality of care that we do deliver. And all of this altogether has a negative consequence on patients, since they are faced with longer waiting times due to staff shortages, as well as a decrease in the continuity of care that we do give to them. So overall, Brexit has definitely increased the pressures that the NHS already has in terms of staffing, and overall the outcomes on the patients has been one that is negative.
Station 3. In the context of NHS values, how will you promote inclusivity and diversity in patient care and medical teams?
Respect and dignity are core principles of the NHS. Inclusivity ensures that every patient is valued, they have an intrinsic value to who they are, and diversity ensures that we have a varied number of perspectives into the healthcare that we deliver to patients. And since the UK is filled with a very diverse population, it's paramount that we uphold these values to the highest standard possible. And there are a lot of ways that we can make sure that we are inclusive and the healthcare that we deliver is diverse. And there are a lot of ways that we can ensure that we remain inclusive and diverse. And these are things such as promoting cultural competence, enforcing inclusive policies, engaging in community, and finally offering care to patients that's very tailored towards them. Remaining culturally competent means that we are aware of the different sort of ethnic backgrounds and sort of socioeconomic statuses of all of our patients. And there's a lot of ways that we can do this, particularly by making sure that students, particularly medical students, learn about these throughout their medical education. But from what I saw in my work experience, this is also something that we can enforce within the hospital. So during my work experience at a hospital, I saw that there were blocked out hours, for example on Wednesdays, where different healthcare professionals can learn about a particular topic. And there was one topic in particular which was to do with FGM and how it was very prominent in the African region. And it highlighted how healthcare professionals should remain very vigilant when clerking patients who are from this region, and really eliciting whether they have been affected by FGM and what are the sort of resources and things they can do to make sure the care that we deliver them is very tailored. Additionally, another way that we can promote inclusivity and diversity is by doing a lot of community engagement, which means that we go and work with underrepresented groups, either from different ethnic backgrounds or from different socioeconomic backgrounds, and really understand what their problems are and how we can provide them with the best healthcare possible. Furthermore, we can also enforce inclusivity policies, such as advocating for non-discriminatory initiatives that are in place within the hospital or within the work setting. And finally, we can, using all of these together, we can tailor the care that we deliver to our patients by, again, being very aware of the sort of culture they come from, the sort of background they have, so we can address all the biopsychosocial needs that they may present with. So, overall, inclusivity and diversity foster a very equitable stance towards healthcare by making sure that we address every patient's needs. And it also makes the NHS a very welcoming place to have your needs being addressed.
Station 4. Discuss the challenges faced by rural healthcare services in the NHS. How will you address challenges in accessing healthcare?
So rural areas in the UK face very unique challenges, which are to do with the demographics and with the geography which tends to be very rural, very mountainous and very hard to access. So we can see that the main challenges arising from that are accessibility issues, the limited facilities that patients might encounter, and the best ways to address these problems are by increasing our workforce in those areas, increasing community awareness, and also engaging in things like telemedicine. In terms of accessibility issues, since patients are very far away from the more urban areas where we see our specialised centres, it's very hard for them to access those areas, whether it be they may not have the right transport or the money to access these areas. Additionally, since these areas tend to be very rural, it's also very hard for staff to commute to patients or the respective centres that may be there in those hospitals, which means that we have lower retention rates for our staff as well. Additionally, there's also the issue regarding the limited resources that we do have, since patients live very far away from the main areas where resources are funneled into. The best ways that we can address this is by increasing the workforce, increasing the number of staff that we have. If we increase their training, we can potentially might see an increase in these staff wanting to stay in these rural areas and commute to these rural areas. We can also engage in things such as using mobile clinics, whether it be mobile clinics for vaccinations, for checkups, which means that patients won't actually have to leave their areas to access healthcare. Healthcare can be in their small village or in their small town, readily available for them. Also engage in something called telemedicine, which essentially means that instead of patients having to commute to doctors or doctors having to come to patients, or even healthcare staff having to come to patients, they can do consultations remotely via online Zoom meetings or online Teams meetings, which can make communication very easy for the patient and for the doctor as well. And finally, we can also increase community awareness by letting patients know where the nearest resources are available for them. So overall, there are a lot of things that we can do in order to help patients who live in these very remote areas, such as engaging in telemedicine, which has been rising over the past few years and has been successful, and also utilising things such as mobile clinics.
Station 5. What are the benefits and challenges associated with recruiting international healthcare professionals into the NHS?
International recruitment really helps the NHS when it comes to staff shortages. However, there are a lot of challenges that do come with this. In terms of benefits, the main ones are that we attract global talent via this process, and we can really fill in the gaps within our rota. However, the challenges are to do with cultural adjustment, visa issues, and also staff retainment as well. In terms of attracting global talent, if we open up a lot of our roles to international people, it means that we attract a lot of skilled individuals from all different types of backgrounds who all have their individual perspectives towards healthcare, and this can be very beneficial, particularly for the NHS, where we treat a lot of different patients who come from who come from a lot of different backgrounds. So in fact, this can actually improve the patient outcomes that our patients do have. Additionally, it can also fill in a lot of gaps that we have within our rotas. It's a very effective way to burden the current staff shortages that we have for the short term. However, that being said, there are a lot of problems that come with recruiting international professionals, the main one being visa-related issues. Immigration in the UK is very tough, and it can also be a very lengthy and a very expensive process for international professionals. Additionally, there's also the issue regarding retention. Although recruiting from international countries is a great way to relieve pressure short term, it can be very difficult to retain these staff in the long term, which means that we're not really addressing the core issue that the NHS has in terms of workforce shortage. Furthermore, there are some ethical concerns about recruiting international professionals. So the main concern around this is that a lot of these professionals come from very developing countries where their skills might be more useful there as opposed to the UK, where we're already a very developed country. Additionally, there's also the idea that the UK, by recruiting international professionals, they're actually prioritising these international professionals over the current, staff or doctors waiting for job posts in the UK, which can also be very frustrating for the current staff that we have already. And finally, there's also the current issue about the logistics behind recruiting these professionals. So on the news recently, I saw that there's some professionals, like for example nursing staff, who've come from different countries. The certificates aren't actually valid or they're fake, and once they do come into the UK, they're actually practicing without having the proper qualifications, which has had negative consequences on patients. So overall, although recruiting international professionals can be a very great way to reduce the staff burden that we have within the NHS, but there's a lot of logistical problems that come with this and some ethical concerns too.
Station 6. What is your understanding of clinical audits and quality improvement initiatives to enhance patient care standards?
So clinical audits, they evaluate current practices against a particular standard, and quality improvement initiatives, they aim to improve outcomes, whether that be by getting these particular services back up to standard. And both of them, I know, they first of all measure performance, they drive improvement, and they both improve patient safety. In terms of measuring performance, they do this by first of all understanding where problems are, and then they engage with a lot of different teams to improve certain services over time. In terms of driving improvement, they do this based off of evidence-based practices, and they assess improvements over time as well using a lot of data. And both of these, they improve patient safety, and this is done by reducing errors in particular services, but also by improving patient outcomes in general. So on the whole, clinical audits and quality improvement services, they uphold the NHS care quality and patient safety as well.
Station 7. How do you perceive the overall effectiveness of locum doctors, and what strategies would you implement to maximise their impact and integration within the healthcare team?
Locum doctors are a very important part of the NHS, and they provide temporary staffing in trusts or in clinics where they're most needed. The best thing about them is that they fill in a lot of gaps within the rota, which is essential for the continuity of care that we want to deliver to our patients. However, there are issues regarding their integration into different healthcare trusts, since they are moving around quite a lot. And there's a lot of ways that we can help them and maximize the impact that they do have. And we can do this by providing them with the right support and making sure they have thorough onboarding processes. Additionally, we can also make sure they have the right protocols to follow and that there's constant feedback to optimize the impact that they do have. So first of all, we need to make sure that the onboarding that they do have at these trusts is very thorough. They need to know where all the resources are, who to contact if they have emergencies or troubles. Additionally, we can also make sure that they are very integrated into the team, that they have permanent staff there as a point of call. Furthermore, we can also make sure that they have the right protocols, they have set guidelines that they do follow to make sure that the care that they do deliver is in line with the permanent staff and the care that they give to their patients. And finally, We also need to evaluate and give them constant feedback on the services that they do provide to ensure that the healthcare that they deliver is of the highest quality and they're having the highest impact possible. So overall, locum doctors are very important. They allow for a lot of flexibility within the NHS. However, we need to make sure that there's the right resources in place for them to integrate thoroughly into the systems that they do work in.
Station 8. What are your insights on the digital gap between colleagues in the NHS?
So the digital gap refers to the disparities in access to technology as well as the skill set that staff have within the NHS. From my work experience at a hospital where I was in different departments, I saw that one department, all the notes and everything to do with the patient was all written on paper, whereas on the wards in a different department, things were all online. All the patients' records were kept on digital computers and etc. And this raised particular issues surrounding the consistency of the data that was being held, but also therefore the healthcare that these staff did deliver to patients too. And there's a lot of ways that we can address the digital gap. One of them being enforcing training programs as well as investing in infrastructure. In terms of training programs, we can all make sure that all the different staff that work in these different departments all have the relevant and the right training for the particular software or for the particular digital tools that they are working with, to make sure everyone's on the same page and everyone understands the same things about the particular software. Additionally, it would also be a very good idea to foster peer-to-peer learning where different staff can help each other out when it comes to navigating particular softwares, etc. Additionally, I think it's also a very important idea to invest in infrastructure where we can make sure that all different departments within a trust or within a hospital all have access to the same digital tools or the same softwares to store data, for example. And this means that it's consistent throughout the hospital and therefore the healthcare that we deliver is also equally as consistent. I think bridging the digital gap between healthcare staff and different colleagues within the NHS is very important and can be done via a lot of different training models and also by investing in infrastructure, since it ensures that the healthcare that we deliver to patients is very consistent and their continuity of care is again consistent on the whole.
Station 9. Explain the idea of social prescribing and its potential impact on patients' well-being.
So social prescribing connects patients to non-clinical forms of care, and these can be things such as outdoor activities, creative programs, and community groups. And all of these aim to give a patient a more of a holistic care towards their particular issue that they may have. Outdoor activities such as group meditation, nature walks can be a green prescription given by doctors towards their patient, and this can be particularly useful for patients who are elderly, suffering with isolation, or patients with mental health disorders. Additionally, creative programs such as art or music therapy can also be a great way to relieve stress for patients suffering with anxiety and even more significant mental health problems such as PTSD. And finally, community programs such as Alcoholics Anonymous for patients suffering with alcoholism can be a great way to talk to other people going through the same thing and can be a great addition to their overall treatment plan. So overall, social prescribing can be an excellent way to tackle not just the clinical needs of the patient, but also the more holistic mental and social needs of a patient as well. This ultimately ensures that the care that you give them is very holistic and one where you've addressed all of their needs.
Station 10. How will you promote community-based healthcare to enhance patient access?
Community-based healthcare means delivering healthcare at a local level, which can really reduce NHS pressures that it may have at secondary centres or at tertiary centres as well. And there's a lot of ways that we can deliver community-based healthcare, and it can be via things such as telemedicine, home visits, local clinics, as well as healthcare campaigns as well. In terms of home visits, we can have GPs or community nurses come in at a patient's home and help them out, but whether it be via changing dressings if they have diabetes or just providing consultations. And this is ideal for patients who are frail, who are at more advanced stages of their disease progression, as well as patients who, for example, don't have enough money to access healthcare services as well. Additionally, we can also engage in telemedicine, which is where patients can see their GPs or they see their consultants via online means, such as during a Zoom call, a Teams meeting call, and this means that they still have access to their healthcare online. Furthermore, we can also provide local clinics for patients who are in underserved populations. And these clinics can be for things such as vaccinations or for screening programs for STIs. And this is ideal for patients who are in areas where they don't have access to these good facilities. And finally, we can also promote healthcare campaigns in particular areas that, for example, that lack an uptake in vaccinations compared to the national population. And again, this is ideal since it allows patients to learn about these conditions or learn about any diseases that they may have, again improving access to good healthcare. So overall, community-based medicine really strengthens the access that patients have to healthcare, particularly if they are from underserved populations. As well as this, it also reduces the strain on the NHS as well.